So this is a good part of AI. A widely available AI tool now helping some doctors diagnose super rare diseases in kids. There's this new study out showing how a program from OpenAI helped researchers at Boston Children's Hospital identify which errors in patients' genomes might actually be causing their illnesses. It has helped diagnose 18 kids whose rare conditions had previously stumped doctors. One of the lead researchers on the team calling it a total game changer.
Usually you have to be at a major medical center to have access to these type of analyses, or they can be expensive. If we can cut down on the time, cut down on the cost, that's a game changer and will let reanalysis happen faster and more frequently.
And Jared Perlo is joining me now on this. This is super fascinating, to say the least. But I think obviously always when it comes to AI and something new that emerges is, okay, how exactly is this working? And then how is it affecting people?
Yeah, so super exciting research in this case came out yesterday in the New England Journal of Medicine's AI version. So very fresh research. Basically what happened here is kids visit Boston Children's Hospital all the time to get diagnosed. However, a small subset never receive diagnoses. They just have really complex diseases. Doctors don't know what's happening. Those people get their genome sequence. It goes onto a file, kind of just sits on the shelf in Boston Children's Hospital. From time to time, they'll reanalyze it, say, maybe we have some new ideas about genes that are causing the diseases we couldn't previously answer. Now, last year, the researchers at Boston Children's Hospital teamed up with OpenAI and said, what happens if we use just off-the-shelf large language models, basically the systems we could use with ChatGPT, upload their genetic data, upload some genes we think might be causing the illnesses, and see if we can get any new diagnoses. And it's almost like magic. They found 18 new diagnoses for kids who had visited the hospital over the past couple decades, 376 cases across 4 disease areas.
Were the diagnoses very specific? It is this, or it could be this, or it could be this?
Very, very specific, down to specific gene deletions. So if we zoom out, today's AI systems excel at this, crunching data. So that's exactly what the researchers did. They used the power of these artificial systems, these artificial brains, threw basically everything at the wall, said, what can you tell us, that human analysts might have missed, whether because they didn't have enough time or they didn't have the specific genes. They just didn't know whether A and B, resulted in specific diseases.
Are other hospitals, other medical facilities adapting this?
It's a slow rollout, but I chatted with some patients who actually received new diagnoses, and they say one of the most exciting parts is that this could be democratized to basically anyone in the country. This happened with OpenAI's O3 model, which was just a commercial model. This isn't something behind the scenes.
So I was going to say, it seems pretty accessible.
Exactly. One of the researchers we just heard from said she grew up in the Midwest, and she says, in my little town of 5,000 people, doctors there could have come to the exact same result, and that's just exactly. So this is, very exciting, and I think we'll only get more powerful systems and hopefully, better outcomes for patients from here.
So cool, and so great for those families who didn't have a diagnosis for their kids.
For 15 years,
yeah. Jared Perlo, thank you. Thanks for bringing that to us. Appreciate it.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.